Hey everybody, Jason Burmis here. And, while I was going through my research today, I noticed that Andrew Cuomo, whom I love, I'm going into this one with the most positive attitude you could possibly imagine. New York loves him. Andrew. He's America's governor, okay? And we love him. So I saw that he was holding one of his press conferences, and as you know, we often play segments, but it's been a while since we did a watch-along. And if you watched my earlier video, my back is killing me. So I figured, it was already going to be very uncomfortable for me to watch this as I realized this was an Anthony Fauci on the phone love fest. When I mean on the phone, video conference. I would expect this to be as fun or better than when he had Eric Schmidt on. Because right now, you're going to get a whopping dose of the kind of authoritarianism that, I love. And apparently America can't get enough of. So I figured that you might want to go get your vomit buckets ready, because we're going to have so much fun with this, and this is going to be so fun, I can feel, that, you might have to relieve whatever's in your stomach as you watch Andrew Cuomo joke from the very beginning. These people think it's hilarious. So all we can do is laugh with them. So if you're in there, gear up. This one's going to be a long one because they had a long love fest. I just kind of dick-a-dude through it, and we're talking we could be here for an hour. Fully demonetized on this platform because we love Andrew Cuomo so much. And we can't get enough Tony Fauci over here. And we dare show you, actual studies, papers. We have opposing opinions and views here than what the mainstream narratives are. Weird. So $5, $10, $15, big donors. You mean the world to me. Remember to Rockfin. We do it live, 11 a.m., Monday through Friday, only at Rockfin. If they take me off this platform for loving Andrew Cuomo and Tony Fauci too much, because that could happen, because I love them a lot. They are loved right here. None but love in my heart. Okay? Make sure that you have at least the free account and you're coming and join the fun, man. We do it live, and who knows what tomorrow will bring. So thumbs it up, subscribe, share. If you're not a member of the full Burmis Brigade yet, check out all the documentary films. They're free in the playlist section right now. There's some news stories up here, but we'll see if we go to those as we really ham it up with Andrew Cuomo, a man I love. Yes, I love this man. He's done so many good things for New York. Here he is. Day 282.
Glass half full, glass half empty. I want to thank New Yorkers and all the people who gave me great birthday wishes. My birthday was yesterday. People were curious. I was 39 years old. Again, I'm just going to repeat that number 39. I like it, so I'm going to sit on that for a while.
He thinks he's hilarious.
But I had as great a birthday as you can have in this new normal. My daughters came up. It was all great. Dog gave me a bone. We have a special guest with us today, Dr. Anthony Fauci. Dr. Fauci, I like to call America's doctor.
You're America's governor.
He was probably the singular voice, in my opinion, as a medical professional who offered guidance and facts and clarity to people all through this, countrywide, worldwide. He always stuck to the science. He always stuck to the facts. He was clear when it was difficult news. He offered the facts.
So while we're about to get to clarity, remember, this is a guy that on Tapper said, after the vaccine, you're still going to wear the mask. You're still going to social distance. Warner Brothers, the Hollywood propaganda arm, which I love. I love Warner Brothers. Don't you love Warner Brothers? They've already announced every movie they release in 2021 will be released streaming. Do you understand what that means? That means Hollywood already knows this doesn't end in 2020. It doesn't end in 2021. Are you getting the picture? These guys love each other, and I love them. We love, love, love here.
He did it in a way that was calming, but was truthful. And that's a hard balance. But he did that extraordinarily well. He's also been very kind to me. I've spoken to the doctor many, many times throughout this situation, and he's given me great advice and great guidance. He was also very helpful to New Yorkers on a personal level. He was very helpful to my brother Chris when he got COVID early on, gave him good advice.
I want to tell you, New Yorkers love Tony Fauci. I don't even know if you get above the line from, the city into, Rockland County or Dutchess or Orange or any of that without a lot of love for Tony Fauci. And the further you go up for Tony Fauci and Cuomo, they love both of these guys. A lot of love, a lot of great advice. Remember, when the facts aren't the facts, guys, when Andrew, I love him, Capo Cuomo, tells you the facts aren't the facts, and this is the guy that's giving him the facts, it's a match made in heaven.
But the doctor has been a great, great friend to New York. I'm just worried when the doctor sends us the bill for all the consultation that he gave us. But you know what, doctor, maybe you could take just to ease bookkeeping, you take the Cuomo consultations, me and my brother, put them together on Chris's bill, send Chris the bill. He's a very generous person, my brother Chris.
How Andrew Cuomo didn't make it in stand-up comedy, I'll never know. Because I love him so much, and he is so funny when we're in a serious pandemic of day 282, where crime has almost tripled in his city, violent crime that is, and shootings have over doubled. It's hilarious. He's a funny guy. This guy's great. He's funny.
So I'm sure that'll be fine with him. Doctor, let me give you a sense of where we are and give you the facts today. And then I'd like to ask you a couple of questions to get your advice on where we go forward as this situation changes. Our positivity rate today, without what we call microclusters. Microclusters are the high problem areas in our state, which we have localized, and we have special strategies in them. And they have a higher percentage rate than the rest of the state. They're small zones, but they're intense positivities. Statewide, without those zones, we're at 4.2. If you add those zones in, we're at 4.7. The positivity in those high-intensity zones is 6.5. We did 152,000 tests yesterday. On a Sunday, tends to be our lower testing day, but we still did 152,000 tests. 80 New Yorkers passed away. They're in our thoughts and prayers. 160 additional hospitalizations, 22 ICU, and 13 intubations. Our RT, we estimate at about 1.2 now. When you look across the state, you see a very varied picture.
Let me just stop that. What do you mean, varied picture? Varied picture. Varied picture. You don't see a varied picture. Okay? 0.03%, 0.04%, 0.02% that are currently hospitalized or probably even had a hospital visit. I love these numbers of how varied it is. It's not varied at all. It's between 0.02%, actually 0.01% when you get to North County, when you really get up there, to 0.05%. To 0.05%. What is he talking about? Give me a break.
This is number of people who are hospitalized, and we look at the percent of the population that is hospitalized. So, for example, the highest percent of hospitalization is actually upstate. Finger Lakes, that's Monroe, Rochester area, Buffalo, Western New York, Central New York. You come down to New York City, Long Island, we actually have a lower rate hospitalized than upstate, which is an exact flip of where we were in the spring. Spring, we had a largely downstate situation, and upstate, the situation was much better. New York State, we've done a couple of things that are different than other states. In New York, the state sets all the policies on close down. The state keeps numbers that are determinative of the policy.
You see, what I love about it is these numbers and these determinations are based on how economically devastating it can be for the small business owner and the community, and not for billionaires like Jeff Bezos, Michael Bloomberg, Bill Gates, and Eric Schmidt. That's why I love him so much. That's why I love him so much. Fauci's just gearing up. Get ready, because if you haven't seen so much love, we don't even have 100 thumbs up. You're not loving this broadcast? This isn't a big love fest?
We don't do it on a county or a city level. This, to me, avoids what I call the hodgepodge effect. Hodgepodge is a technical medical term that we have here in New York. We also apply it to government. Hodgepodge, just a discoordinated mess. It also reduces forum shopping. You know, when you see states where one county's open, one county's closed, you want to go for dinner, you go to the neighboring county. You want to go get a haircut, you go to the neighboring county, which only increases the number of people traveling, which is exactly what you don't want to do. And it reduces the confusion. We're also then taking it to the next level. We try to coordinate with surrounding states.
We try to get that grip as tight as possible.
I try to coordinate it with New Jersey, Connecticut, et cetera, because if I close a restaurant but you live in Brooklyn and you can drive to New Jersey, then all I did is increase the traffic in New Jersey. It's not a perfect coordination, but in lieu of a national set of firm guidelines, which is frankly what I would have liked to see, we have come up with a regional compact of guidelines. We have been very transparent and communicative with New Yorkers. We have websites. I give them numbers every day. I wanted them to hear the facts. If anything, I've been accused of being overly communicative, especially at home. But the more facts people know, I think, the better. And we have been religious about following the data and the science.
We've been religious, all right.
We do more testing than any state in the United States by far. We have more data points by far, and we rely on the data. And it's not anecdotal, it's not political, it's not an opinion. And we also started something called the Surgeon Flex Public Health System Management, which is something we're going to be implementing in an increased way today. Surgeon Flex is not the most creative name, but what it says is we surge and we flex the hospital system in the state. We start with 54,000 hospital beds statewide. We can then mandate by the Department of Health, Dr. Howard Zucker to my left, Jim Malatras to his left, Gareth Rhodes to my far right, Melissa DeRosa to my right,
When you see everybody in their shields and their masks, you're going to love, like I love, the dystopic look of this whole thing. Man, Cuomo is just loving to lay out like his great Johnny nonsense, let's be honest.
Dr. Zucker and Melissa, you've worked with them. But Dr. Zucker can order a 50% increase in beds, which we've done before. Dr. Zucker can order no elective surgeries, which we have done before. And we can create field hospital beds, which we've done before, and we can create several thousand field hospital beds.
I don't know why you would have to do that, seeing you're at a 0.001 hospitalization rate to 0.01 to 0.05 hospitalization rate throughout the state. We're not even talking about One out of 1,000 cases. A 0.1. Okay, now I'm going to do some simple math for you. I know we all went to fourth grade, but let's do it. If it were 1% of the cases, if it were 1%, that would mean 1 in 100 cases. If it were 0.1%, okay, that would mean 1 in 1,000 cases. The best they have is 1 in every 2,000 cases is going to the hospital. So why are we even talking about surge and flex? It's a constant distraction pattern that I love. I love these guys. They're the best.
So when you look at our hospital capacity, we start with 54,000 beds. You can increase it by 50%. Takes you to 75,000 total bed capacity. Roughly 35,000 of those beds are now occupied. If you cancel elective surgery, we estimate that you reduce the number of occupied beds by about half. That takes us to a total system capacity of about 58,000 beds for COVID patients. Today we have 4,600 hospitalized. So that gives you a range of the capacity for the system. We can also add 5,000 additional field hospital beds. That would be, from my point of view, the last resource. We did that. The Jacob Javits Center, for example, we did 2,000 beds.
And you know what I love about the Javits Center? How much Andrew Cuomo didn't use it. I love that he took elderly, sick people in nursing homes and then put them back in nursing homes with elderly, sick people. It was very loving of him because he loves you. The way he utilized the Javits Center before and now to invoke it shows you how much he loves you. It's love.
Dr. Fauci, it looked like a field hospital in an army. You just saw an ocean of cots.
I love how he calls them cots, because what's loving about them is at the time they were not exactly cots. They were the plastic grave liners of FEMA. Did you hear what I said? I put that story out way back in the day. Go back. It's around March or April. But that's what I really loved about it. It was actually the coffin liners that FEMA uses, right? Flipped over with a mattress on top. That was a cot at the Javits Center. But we still didn't use it because we just thought, let's put the elderly, sick, COVID positive patients with other elderly and sick people, the most vulnerable, because we love them.
And I just hope we never have to get to that point. Today, the Department of Health is going to issue an order saying hospitals have to increase their bed capacity 25%. We can issue up to 50%. They can do that physically, but we're only going to go to 25% because we don't have a capacity criticality at this moment. We are aware of staff resources. The staff comes into this stressed, right? You want to talk about a long year. Nurses, doctors, hospital workers, 1199, they had the longest year of anyone. So they come into this stressed. We're going to ask retired doctors and nurses to sign up, and we will automatically re-register them in the state without cost.
Now, let me ask you something. Because these people are so loving, do you think that they're trying to up the nurses and the doctors because they have a 0.01 to 0.05% hospitalization rate? Is that what you think? Or do you think that this and Dr. Fauci are going to start talking about the vaccination program? I wonder. I don't know for sure. I haven't watched this yet. I've watched a lot of love here. But I'm just wondering if that might be the case because they love you so much.
We believe we can get about another 20,000 nurses and doctors from this mechanism. And then the flex on the surgeon flex is we have 215 hospitals. What happened in the spring, interestingly, was not that the system was overwhelmed, individual hospitals got overwhelmed. And the individual hospitals did not have the capacity to balance patients. Frankly, this was an education for me. So
because again, he didn't utilize the centers and the ships that he got. He got a ship, which they sent away.
Public hospital systems. And let's say you have a public hospital system that had 10 hospitals. One hospital gets overwhelmed. They did not have the capacity to balance those patients among their other 9 hospitals, right? So even in the public systems, before somebody walked into one hospital that was already overburdened, they didn't say, hold on, I'm going to put you in a ambulance and drive you to my sister hospital that has less volume. What our flex says is those hospitals have to flex patient load and share it first within their system. We also shift patient load among private hospitals, which was frankly more unorthodox, right? You go to NYU Langone, you think you're going to NYU Langone. What we say in the flex is if NYU Langone is filled or at capacity, we're going to transfer you to Mount Sinai or another hospital.
You know what I like? No, I love is how he talks to you like a child. Like he just had to explain that for a minute and a half when he basically could just say if they were too packed at one hospital, we put them in another. And we didn't utilize the very, non-loving facilities, right? But I love how he handles this.
And then we actually have the capacity to shift between public and private systems. None of this has been done before. It was highly disruptive for the hospital management system. But we started it in the spring. It went fine enough, and we now have had more experience in it. We've started the flex management system, where every night we get an inventory from every hospital doctor. How many patients do you have? How many ICU beds do you have? What capacity do you have? And we do that on a daily basis. If our hospital capacity becomes critical, we're going to close down that region, period. We call close down a red zone. What is critical hospital capacity? Our formula is if your 7-day average shows that within 3 weeks you will hit critical hospital capacity.
So I love how he's already setting you up for the facts aren't the facts pseudo hype. It's not even a real metric. It's a metric based on a metric 3 weeks from the original metric of an average. What? Huh? And he's not even telling you what that metric is.
We close you down. So if your 7-day average says if that continues for 3 weeks, you're going to hit critical hospital capacity, we close you down. We want that 3-week buffer. And then we call critical 90% of your hospital capacity. So a little complicated. If your 7-day average says if it continues for 3 weeks, you're going to hit 90% of your hospital capacity, close down. CDC changed their guidance on Friday. Some have been critical about the changing guidance from CDC. I'm not. I believe as the facts change, your opinion changes.
See, I love it because, the facts aren't the facts and they never have to be. This way the restrictions can get tighter and the lockdowns can just continue as I'm telling you they're going to. Again, Warner Brothers isn't announcing all of its movies are streaming because movie theaters are going to be open throughout the nation. I love how, Tony's just sitting back, letting the capo do his work, huh? He's like, as the facts change, my opinion can change. As the facts aren't the facts, I can do what I want. I'm authoritarian. I'm Andrew Capo loving Cuomo.
As the facts change, your strategy should change. I don't have a problem with that. But they offered additional guidance on indoor dining, especially. And we're going to follow their guidance. If after 5 days we haven't seen a stabilization in a region's hospital rate, we're going to clamp down on indoor dining.
That's it for you.
5 days,
restaurants.
if the hospitalization rate doesn't stabilize in New York City, we're going to close indoor dining. We're now at 25% in New York City.
So that means Saturday. Local
in the rest of
business
the
owners.
state, any region where the hospitalization rate doesn't stabilize, they're now at 50% capacity indoor dining. We're going to go to 25%. We have zones that are called orange zones where it's already closed. That wouldn't apply here. Bottom line for us, I see it as hospital capacity versus vaccination critical mass.
Oh, look at the twinkle
I
in
think that's
Fauci's
the
eye with the
ultimate bottom line.
vaccinations.
Can your hospitals handle the increase until you start to see a reduction from the vaccinations? On the hospital capacity, do everything you can do to slow the spread, and then at the same time accelerate the vaccines. The frustrations we're seeing here, we estimate over 70% of the spread is coming from small gatherings, and that's a problem. We're going to go through the holiday season. I think there's going to be more small gatherings. I've been talking until I'm blue in the face about the apparent safety of being at home, the apparent safety of being with your family, but that can be misleading. Your brother, your sister, your mother can love you, but they can still infect you. I know you think you're sitting in your living room and you're safe, but your living room is not really a safe zone. This isn't a political question. Trump's CDC and the Biden advisors all agree on the small gathering guidance. But it's about personal responsibility and community concern, and I'm telling you, compliance is a major issue for us here. I'm also frustrated that we see polls that suggest a high percent of Americans are not ready to take this vaccine.
Let me stop that. Not only a high percent of Americans. I mean, again, this guy, crime has gone through the roof. Do you think that with the FDNY, more than half of FDNY say they'll refuse COVID-19 vaccine? At least 55%. About 55% they're saying. Says, no bueno. It's not very loving. You don't love Cuomo? He loves you. He just wants to give a little boop-a-boop. Because it's a boop-boop. It's a boop-boop. And don't worry, CNN announced the vaccine cards coming here. We got a nice look at them in the UK now. Look how loving. They have a heart on them. It's full of love. They love you. It's all about love, guys. Love, love, love.
49% nationwide. Bigger problem in the black community. 57% say they're not ready to take the vaccine. But 75% to 80% needs to be vaccinated to hit critical mass on the vaccination. And that's a problem. If you have 50% saying I'm not taking it, but we have to hit 75 to 80. The good news is New York still has one of the lowest positivity rates in the nation. Only Maine, Vermont, Hawaii are lower than we are. And Maine, Vermont, Hawaii, beautiful states, but different than New York. They don't have the cities, they don't have the density, etc.
Let me just stop this right here. I'm living in Iowa. They're trying to say, I don't know what graph this is, but I love how it says 39.6% positivity rate. Well, how many people are they testing? They're obviously not testing everybody. 39.61. It's just they're not doing as many tests. South Dakota, Idaho. That's how they inflate numbers, guys. Do you think they tested as many people as New York? I live here in Iowa. Where's Illinois on that list? Is Illinois much lower because it's a Democratic state? And they're doing more testing? Hold on, let me look for Illinois because I love this. I love that number. It's very loving. Where is Illinois? What number are they? They're trying to say that Iowa is number 4. That is ridiculous. That is ridiculous, folks. Come to Iowa. Check it out. A lot of cool people here. Am I the only one not seeing Illinois? There it is. It's 31st. 10%. Listen, Illinois is right over the bridge. I'm 5 minutes from it. So to see, they're doing a lot more testing. That's all that means. A lot more people are being required to be testing. Oh, boy. But I love this. It's love.
For us to be down that low is really good news. As a matter of fact, our worst region, our highest region in terms of positivity, is still lower than 41 states. So it's tricky because relative to everyone else, we're doing well. But
do you see how that's a manufactured number? Like, do you really believe that, that the infection rate is 10 times as great in some places? 8 times as great? I mean, that's 8 to 10 times as great. Where I live? That's ridiculous. Come on.
The real question is, it's not a relative contest at the end of the day. It's how you're doing in your state. So to recap, we're going to monitor the hospital capacity. If it doesn't stabilize, we're going to reduce the indoor dining restrictions. We go to 0 New York State, 25% everywhere else. We close down if you hit critical hospital capacity. We're implementing the surge and flex. We're going to add 25% additional hospital beds, renew the registration for nurses and doctors to get us a backup staff pool, continue to caution on the small spread, and at the same time, we are gearing up to have the most efficient, most effective, most fair vaccination program in the country, reaching out to the Black community, Latinos, undocumented, to make sure that it's fair.
I love how they are referring to Latinos, Black people. This is my love here, okay? Minorities, undocumented, as fair distribution when they're talking about what? Targeting poor people. I hate to tell you that, but targeting poor people. They're talking about equitable. They're talking about targeting. I love they're targeting poor people. As a person that grew up very poor, I love being a target of loving vaccination programs that in the headlines say they're going to be aggressive. So here we come. Here comes the Fauchster.
So a couple of questions for you, Dr. Fauci. That's what we're doing. In general, your opinion has always been valuable to us. The holiday spread, I think it continues through Christmas, Hanukkah, etc. Trying to guess, and I know it's a guess, when we could see a peak to this holiday spread. Is it after New Year's? Is it January, mid-January? Do you have any guess, educated point about that? And again, thank you very, very much for being with us.
Well, thank you very much, Governor, for giving me the opportunity to listen to what I found to be a very interesting plan that you have for New York. It seems really sound, and you have a lot of backup contingencies, which I like. So you're not going to get caught shorthanded on this, I'm certain. So thank you for that. With regard to the issue of the holiday spread and the peaks, they're going to be superimposed upon each other. So you would expect the full blunt of the travel and the family setting gatherings with friends that you alluded to as being a problem, you'd expect that the effect of the Thanksgiving surge would be probably another week and a week and a half from now, because it's usually 2.5 weeks from the time of the event.
I mean, I love that we're talking about Thanksgiving now, which is well over a week. It's actually a week and a half ago, Fauci. You know, and remember the original thing was 14 days of quarantine, but we'll move the goalpost a little further. I love that. The facts aren't the facts. There's a lot of love here.
The problem is that's going to come right up to the beginning of the Christmas Hanukkah potential surge. So you have a surge upon a surge, and then before you can handle that, more people are going to travel over Christmas. They're going to have more of those family and friends gatherings that you accurately said are an issue. So if those two things happen and we don't mitigate well, we don't listen to the public health measures that we need to follow, that we could start to see things really get bad in the middle of January. So I think not only for New York State, but for any state or city that is facing similar problems, without substantial mitigation, the middle of January can be a really dark time for us.
Oh, it's going to be dark. I love that. And I love that it's every city and state, too. I mean, let's not be broad about it or anything. I mean, you know, the Fauci, you got to love him. You got to love him. And again, guys, Warner Brothers announced all their movies are streaming for 2021. All of them. Love your mask. Love the social distancing. Love the fact that it's not 14 days anymore. It's from what? Thanksgiving to Christmas. It's surge upon a surge. And then New Year's is the triple surge. It's the 3 spot. It's not a double down.
But as you said in your presentation, Governor, there are some things that we can do to mitigate against that. I think particularly the appreciation that it's such a natural thing to think when I have family and friends over for the holidays, Christmas and Hanukkah, you get indoors, you take your mask off because you're eating and drinking, and you don't realize that there may be somebody that you know, that you love, that's a friend, that's a family member, who is perfectly well with no symptoms, and yet they got infected in the community and brought it into that small gathering that you're now having in your home. So that's the reason.
But I love how there's no zone for a closure of a Walmart or any of the big box stores. I love that. That's very loving. And you can't catch it there, apparently, because of the love that's around those places. But you certainly could catch it and, you know, spread it and kill somebody at a holiday gathering where you show love to other human beings because you do love them, because you actually know them, and you want to spend time with them. It's very human of them.
I want to underscore what you said. That's one of the issues. But bottom line for your first question, mid-January is probably going to be the bad time.
The small spread, family spread, living room spread, we call it living room spread here. So like 16 states have done an order of no more than 10 in a home. The CDC guidance, that's President Trump's CDC, says no more than 10. Some states have gone to no more than 8. Compliance is very low on that. Do you think that is a sound rule, that no more than 10 in the home?
Before, Fauci even answers that, I just want to tell everybody how much I love the word compliance. I love being compliant to these two guys, especially, that have shown their state and their fellow human beings so much love over the recent period of COVID-19 84. Nothing but love.
Governor, I think that's a very sound rule. And I feel, 10 may even be a bit too much.
Oh,
it's not only the number,
that.
Governor, but it's the people who might be coming in from out of town. You mentioned in your presentation how you don't want somebody who's from New York who wants to go to a restaurant that's closed in New York. They go to New Jersey and then they come back. They've traveled back and forth. in addition to the absolute number of the people in a home for a gathering or a social setting. You want to make sure you don't get people who just got off an airport or a plane or a train and came in from Florida or came in from wherever. That's even more risky than the absolute number. So not only the number of 10 seems reasonable, but make sure that when people come in, that they're not people who you have no idea where they've been or who they've been exposed to. I mean, you want to be friendly, you want to be collegial, but you really got to be careful about
You got it. Listen, strangers are bad. Other humans are bad. And I love that. I love covering my face. I love not meeting new people. I love not continuing my normal human life because I love they've coined the term new normal. And the new normal is, compliance, which I love. There's so much love here.
that.
Yeah. No, you're so right, Doctor. And the practical implications are so difficult. As I mentioned at a birthday yesterday, one of my daughters who wasn't with me, who wanted to come up, she had a quarantine before she could come to my birthday, So you want to go travel and see someone, it's not just that weekend. It's the whole quarantining process before. And in this state, we have very strict regulations of when you come in, what you have to do. On the vaccinations, looking ahead, 75-80% is going to be very hard to reach. New Yorkers are tuned in, and we're going to be very aggressive on public education, outreach, et cetera. But what does your crystal ball say? When is 75-80 even feasible? I hear anywhere from May, June, July, August, September. What would you guess there? Which is when it's really over, right? When the vaccination hits critical mass.
Yeah, when you have 75-80% of the people vaccinated, you have an umbrella of protection over the community, that the level of community spread will be really, really very low. The virus will not have any place to go. It's almost metaphorically, if you think the virus is looking for some victims, when most of the people are protected, the virus has a hard time latching on to someone. When that happens, Governor, is going to be entirely dependent upon how well we do, how well I do, you do, your health officials, in getting the message out of why it's so important for people to get vaccinated. Because if 50% of the people get vaccinated, then we don't have that umbrella of immunity over us.
Well, I love how they're not talking about whether or not you need to be vaccinated if you have the antibodies and you've already had this. That's not a discussion. I love that. And you notice how he said how well they do. Well, I want people to understand who they are. If you're not following Corey Morningstar, he's doing some really great work, and especially right here. Social influences can be used to promote favorable behaviors of both health professionals and the general population. See, I love how they need favorable behaviors of health professionals. What do you mean? What's a favorable behavior? I thought a favorable behavior. Oh, by the way, this has distributing the COVID-19 vaccine via the UN. That's what this, document's all about. Why would they need to do that? But, 5 strategies to harness social influences are outlined below. And the majority of people are getting vaccinated or intend to get vaccinated. That fact can be publicized to good effect. Communication efforts to promote the perception. I love compliance, and I love telling people telling me what I should perceive. That most people are getting vaccinated, if credible and true, are likely to increase vaccination acceptance, making vaccine uptake visible to others through clinics in prominent public places or by enabling ways for people to signal that they have received the vaccine either on social media, in news media, or in person, can contribute to making the social norm more salient. I love how my safety is a concern in all this. And I love how they're using Karl Rovian dialectic, I love it, to tell me how to perceive reality and how people should perceive reality as they try to get a 75 to 80% vaccination. And I love that the facts change, so that probably won't be enough even later.
But let's say it works out well. Now, let me answer your question specifically. And we do a really good job of convincing people. Between now and the end of December, you would likely get a substantial proportion of healthcare providers and people in your nursing homes. As you get into January, you'll get the second level, and then February 3rd. I would think by the time you get to the beginning of April, you'll start getting people who have no high priority, just a normal man and woman New Yorker in the street who's well, has no underlying conditions. If we get them vaccinated in a full court press, get them really going, and you do that through April, May, and June, by the time you get to the summer, because remember, it's a prime boost, which means you get vaccinated today, you get a boost 28 days from now, and then 7 to 10 days following that, you're optimally protected, even though you could get some protection even after the first shot. But optimally, it's within 7 to 10 days following the second shot. If we do that well, by the time we get into the core of the summer and get to the end of the summer and into the start of the third quarter of 2021, we should be in good shape. That's what I'm hoping for. And that's the reason why it's so important to extend ourselves out to the community, particularly to the Black, African-American, Latino, the people who are undocumented, the people who we really need to get vaccinated.
You got to just, again, love their concern for poor people, because that's usually what rich people are concerned about is poor people. People in power are always very concerned on how much they love poor people. They've never experimented or exploited those populations because they love them so much.
Well, Doctor, I couldn't agree with you more on that. I'm pushing the Congress right now. New York, look, I think it would be discriminatory not to understand the situation that exists with the Black and Latino population, who, by the way, blacks had twice the death rate of whites. Latinos had 1.5 times the death rate of whites, higher infection rate, higher percentage of essential workers. We're going to need a whole effort just to educate and outreach and get into public housing and communicate with their communities, because otherwise I don't think, they're not going to flock to the local Walmart or Kmart or Walgreens to take this vaccine.
So that's great. Let's go to the public housing. Let's go directly to the public housing out of love, because they're lovers. They love it.
I think we're going to need an affirmative effort to do that. Let me ask you this. Our school positivity rate is amazingly low. Even in communities that have higher spread, we're seeing much, much lower infection rates in schools. It's almost a universal statement that the school is the safest place to be in the community. Does that surprise you?
It originally did surprise me because we were always concerned. If you look at the influenza model, the issue is the kids are in school, they get infected, they come home and they infect their parents and their relatives. We're not finding that with this coronavirus. In fact,
I love that now they can say this when Trump said it, whom, maybe I don't love as much as these guys, because I really love these guys. But he used to say that about the schools, and I love how the media attacked him for it viciously and cackled about it. And I love how people that love to puppet mainstream media tried to make me feel intellectually inferior for pointing that out. I love it.
Back to our, I think, real positive spin-off of this is the realization that schools appear to be a place where the positivity, just like you all are seeing it in New York, the whole state, including New York City, you're not alone. We're seeing that in other parts of the country. that the test positivity in school is actually really low, which is really a good thing, which is one of the reasons why, when we were talking about what the best strategy would be, we would say something like, close the bars, keep the schools open is the best thing to do. So,
as somebody who ran a bar and enjoys being in bars and was in a bar this weekend and got to talk to real live girls, okay, and have like real beer and not worry about social distancing or masks, as somebody who loves that, I love that he wants to shut them down. I love that he wants to ruin cash-based businesses. I love that he doesn't want people to socialize and be human. That's awesome. I love it.
Long as you subsidize and help the restaurateurs and the bar owners so that they don't go down and essentially crash because of the economic strain. But if we can keep those things under control, subsidize those people, as well as keep the schools open, we'd be in good shape.
Yeah, and I think you're exactly right. The CDC says more restrictions on indoor dining, which I understand. And again, changing positions when facts change is intelligent. People say we'll remain consistent. I'm not going to be consistent if the facts are inconsistent. And if I see a different situation, I'm going to change my opinion. But
I love how when the facts aren't the facts and the facts continuously change. Again, more authoritarianism. I love that. I love more small businesses being crushed. I love that. I love more restrictions on everyday life. I love that. I love the poor being targeted. I love it. I love it. I love it. I love it. I love it.
the Congress, Washington, also has to understand those bars, those restaurants, they need financial assistance because this has been a long year and they have bills to pay. So you can't tell them we have to close you down without saying, here's the economic reality and we're going to help. Doctor, on the question of this state's infection rate versus other states, we're lower than all states besides Vermont, Maine, Hawaii. Does that surprise you? And how do you explain that?
You know,
I love that the explanation is extremely obvious. It's because you're doing a multitude. You did 152,000 tests yesterday, Mr. Cuomo. You just said that. Do you think they did 152,000 tests? You know what? We're going to do it live. Daily number of COVID tests here in Iowa, since we were in like the 40-something percentile, which was ridiculous. Let's see what we got. Daily testing numbers, COVID, Iowa. How many tests? Yeah, but how many tests did you do? So this is like today. Let's pump that down there. So let's see. 913 cases. How many did you test, though? See, again, with the amount of people that have already recovered from this, okay, the total number of people have tested. All right, so listen. So far in the entire state, this should give you an idea. He says he tested 152,000 people yesterday. You remember that? Okay, 1.2 million and change are the total tests. That means that they've done, basically, yesterday he did 1/9 of the tests that total Iowa has done. That's because they don't test asymptomatic people. Because why would they? You understand what's going on here? And let's just hear the loving answer from loving Tony Fauci, because I want to hear what he has to say. Because the answer is pretty obvious, I mean, if you know basic math.
Well, I have to say, being a New Yorker, Governor, it doesn't surprise me. You guys, as you and I have discussed on many phone calls that we've had, you got hit, with a sucker punch right from the beginning when the cases came in from Europe and the northeastern corridor, particularly New York State, particularly the metropolitan area, got hit really, really badly.
Well, I just love how they say that now, but we have data that shows the virus was at least here in the beginning of December or late November last year, as I've been saying for a long time. It's now proven. I like that the facts haven't changed there where they're going to talk about that. I love it, actually. I love a lot of this. It's a love fest.
You recovered from that. Was after you got hit badly, your baseline level went way, way down and very, very low. And then you did things which were the appropriate way to avoid getting resurging. So the bad news, and it's painful for me to see it from a distance to my place of birth, but you guys got really slammed. And then you rebounded, and you rebounded in a way that you kept your test positivity low because you did the prudent things that you need to do. And I was following it from here in Washington, and I was seeing that whenever it looked like things were getting a little out of hand, you tightened the rope a little bit. And then when things went back, you eased up a little bit. So I'm not surprised that your infection rate is really low because I think you were doing the right things.
You notice I love how he talked about easing up a bit and then the infection rate went up. Ooh, again, he didn't mention one time how many tests he's doing and how they're testing asymptomatic people. Guys, I can assure you that the loving state of Iowa, which I actually do really love so far, it's great. Yeah, that infection rate is garbage. It's 100% trash in representative in reality.
After you had a really serious hit in the beginning when you were there in the late winter, early spring.
Doctor, on this education of the population on both the small spreads and even more now the vaccine, take the vaccine, it's safe. I think that's going to be difficult to do. I think you have tremendous credibility, not just across the country, but across this state. And I think your voice on saying that the vaccines are safe would be important. I said that as soon as the vaccine is deemed ready and safe, I'll be the first one to take a vaccine. Maybe we enlist you. I'll do it with you. We'll do an ad telling New Yorkers it's safe to take the vaccine to put us together. We're like the modern day De Niro and Pacino. You can be whichever.
I mean, I love how funny he is. I love how this is hilarious to him. From start to finish, I love how this is a big joke for both of them. I love that this is our lives, our economic lives, our medical lives. And I love how much they love poor people especially, and they think it's hilarious.
Whatever you want, you can be the De Niro or Pacino. Fauci and Cuomo, I'll give you a friend. Who do you want to be, De Niro or Pacino?
I love also how I've been calling him Andrew Capo Cuomo for some time, and now he's talking about De Niro and Pacino, two notorious movie stars that were doing what? Gangster movies. I love the irony of that. I love it. I love it. I mean, he did get an International Emmy Award. You got to love it all.
Which one do you want to be?
I love them both. I love them both. I don't want to insult one or the other. If I say one, I don't want to hurt the feelings of the other.
Yeah.
So either one.
Who's the politician? All right, last question. I know you're down in Washington. You're doing great duty, but I know you miss New York. We want to figure out what to send you for Christmas. What food do you miss the most that you can't get down there that you could get if you were back here in New York and Brooklyn?
You know, Governor, whenever
I mean, with everything shut down in New York and Brooklyn, he probably can't get much. And I love that. I mean, how out of touch is this?
I need some comfort food, and I dream back of my days in the Bensonhurst section of Brooklyn. The thing that comes to my mind are two things: a nice Nathan hot dog and a really steaming pastrami sandwich.
I love that you can get a Nathan's hot dog anywhere and cook it yourself in 2 minutes, and it's the exact same thing as if you're in New York City. The pastrami sandwich, whatever. I just love Fauci so much right now. I'm gonna stop it there because there might be some more. This is the first time I watched it. There's actually, if you go to the video, there's actually another God, 36 something minutes because they probably ask Andrew, Capo, Cuomo a bunch of questions. But it's a big joke to these guys. Your life is a big joke. And you think that the love stuff is irony. Again, the vaccination cards they're giving you overseas show you how much they love you. 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 Well, I actually do love you guys. Without you, I couldn't do this. So thumbs the video up, subscribe, and share. Remember, guys, you can support me here, which, I absolutely need. $5, $10, $15. It means the world to me. Big donors. Shout out to all you guys. You guys make it possible. Check out me. Check out the Rockfin Monday through Friday, 11 a.m. Make a free account, and then you can join us 11 a.m. Monday through Friday. It's where I'm going to be if loving YouTube doesn't love my content so much. If there's too much love in my content, they might take me off. But this has been a love fest. So make sure you go make the free account. Come on over. A lot of great stuff there. And then if you are a premium subscriber, you get all the content, all the archives, and you get everybody on the platform, and there's plenty of great creators over there. Thumbs the video up on the way out. Almost 500 watching at the peak, I think, on this. So let's get 300 thumbs before you guys go. Subscribe, share, join the Burmese Brigade. Check out all the documentary films. They are free in the playlist section. Loose Change, Final Cut, Fabled Enemies, Invisible Empire, A New World Order to Find, and yes, Shade the Motion Picture. Once again, I really actually do love you guys, and I'll see you on the flip side.